what you're hoping these measures will do to try to tackle these ever-growing waiting lists, for example.
Well, today we're launching a digital revolution for the NHS and care through this new plan. I want patients to have effective and quick access for their health needs at their fingertips, and that's not only better for them in terms of outcomes, but it's better for the NHS. It will save time and it will save money. So the plan we're publishing today covers everything from digital robots to remote monitoring, the use of artificial intelligence, electronic patient records, and that NHS app. Everyone remembers the NHS app from the height of the pandemic. Some 28 million people already have downloaded it. I think that's something like 60% of adults. So we're going to add new features to that over the coming months and years. You'll be able to book your GP appointment and have messages you exchange with your GP. You'll be able to monitor and manage your hospital appointments. You'll be able to access not just your records, but your children's health records. So there's so much more we can do. I've seen great examples of what we can achieve here today at the Great Ormond Street, where they're already a step ahead in terms of digital technology. And really the end result of all this is that I want the values of the NHS from 1948 when it was founded, but we've got to be planning for 2048.
You touched on something then, GP appointments. A lot of people I know are very frustrated. 8 o'clock in the morning, the phone lines are engaged every day. People can't get a GP appointment. How will these measures help specifically in that area?
Well, when it comes to primary care access to your GPs, first of all, we're already investing records amounts. So there's over the winter, the funding that's gone in, over £500 million extra over the pandemic, and that is certainly helping. We're also working with pharmacists to give them more of a role to play in terms of primary care, such as the announcement to do with cancer issues that we made just a couple of weeks ago. But also this digital access, the NHS app is going to make a big difference. In some other countries, they already have more features around accessing primary care digitally, and for those people that want it, if they want a virtual consultation, you'll be able to do this with the app. Those that want face-to-face will be able to book it directly with the app.
What you don't want, I guess, is a spanner in the works in the form of industrial action from the BMA. Are they worth 30%, do you think, Secretary?
Well, look, when it comes to pay, the first thing I'd say is that the NHS workers, whether it's doctors or nurses, they've been doing amazing work, but especially throughout the pandemic. That's why we exempted them from the public pay freeze last year, and they got a pay rise. When it comes to this year's pay rise, of course, there will be one, but I'm going to wait for the final advice of the pay review bodies, which are independent, and see what they say.
One very hot topic related to health, the comments from Danny Kruger MP about not believing that a woman has absolute right to bodily autonomy. It's a very big story at the moment, Secretary of State. Your thoughts about that? A controversial statement.
Well, look, I'm as the Health Secretary, it shouldn't surprise anyone that I want all people, and in this case you ask me about women, I want them to have access to the very best healthcare, and that is why I will soon be publishing, very soon, the first time ever in this country, a women's health strategy, which has been put together by your cross-government, led my department. We had a consultation on this, over 100,000 responses. I think the biggest consultation response we've ever seen. And I think when that's published, people will see just how seriously we take women's health.
One final thought, as a Secretary of State for Health, when you come to a building like this and a place like this, how does it make you feel? It's what it's all about, isn't it?
Yeah, today at Great Ormond Street, and the patients I've met, from a 1-year-old that's had a heart operation to the 2-year-old that I met today, patients from across the country coming right here to Great Ormond Street, I think the best children's hospital in the world, getting the very best care, free at the point of use, paid out of general taxation. That's what the NHS is all about.